Hi guys, welcome to Health and Science. We have a very special guest today. I'm actually very excited. She is the first female plastic surgeon I got the chance to interview. How are you today?
I'm good. Thank you for having me. I'm very excited to talk with you guys today.
I'm so excited. You are so beautiful, guys. She's gorgeous. The
Thank you.
camera don't make any justice. She's gorgeous and tall. She's beautiful.
Thank you. Thank you.
You're welcome. Doctor, can you tell us a little bit more about yourself?
So, my name's Dr. Cooper. I'm a plastic surgeon here in the Dallas area. I concentrate mainly on aesthetic surgery or cosmetic surgery of the face, breast, and body. I'm new to town, so I'm getting started, but I'm very excited to start interacting with the Dallas population here and meeting patients and really being able to provide excellent care to the people here.
Where are you from?
I'm actually originally from Louisiana, Baton Rouge. But my training has taken me all around the country. So I've been to Baltimore. I did my medical school at Johns Hopkins. And then I went to St. Louis, where I did my residency training at Washington University in St. Louis.
Wow. Mm-hmm. How did you end up in Dallas?
Well, I wanted to get closer to home. Being from Louisiana, Texas is right next door. But I still wanted to be in a bigger city. Baton Rouge, where I'm from is a smaller town. I wanted a bigger environment, and so Dallas just seemed to work. And then I also have my mom and my sisters live here now, so it's really nice to be closer to family and have them in town.
Wow, that's nice. Mm-hmm. Family is very important.
Yes, it is.
I'm very proud of you.
Thank you.
I'm really proud. I don't have enough words to tell you.
Oh, thank you. I appreciate that.
You're welcome. What is your special surgery? We all love something about our job. What is that you love the most about your job?
I would say the confidence that I'm able to give back to patients that come to me. So I really like doing my makeovers for that reason. I am a mother of two, so I know personally the changes that the woman body goes through after having kids. And so I think that gives me a nice perspective when I'm talking to my female patients to say, I understand where you're coming from. I understand how your body has changed. What can we do to kind of normalize things now that you've had your children? And so I really get satisfaction with with performing these procedures that really gives these women back their confidence.
That's so important. Mm-hmm. That's also what I love about my job. Mm-hmm. And sometimes we are very hard on ourselves.
Yes, that's the society that we live in, unfortunately. The way that we look is very upfront in the media, social media. And I think a lot of people take that to heart and they see what's on Instagram and they think, oh, that's real. And they don't realize that a lot of that is filtered, but they are comparing themselves to those standards and they're unrealistic standards. And so then there's a lot of self-confidence, a lot of self-esteem issues that arise from that, unfortunately.
How do you handle that with your patients?
So I try to keep my patients with realistic expectations. First, I like to hear what they are looking for. And then if that aligns with something that is I can reasonably accomplish with surgery, then we're on the same page. Good, we can move forward with discussion. If I'm getting the idea that their expectations are unrealistic, if they are comparing themselves to something that's seen on Instagram that I know has already been filtered, then it's a discussion more on education to say, hey, this is what can be accomplished safely and realistically. And really then it becomes a discussion with the patient to say, hey, you are beautiful how you are. Yes, there are going to be some aspects of our bodies that we would like to change, but your happiness shouldn't stem just from changing those things. And so it's really trying to get an understanding. There's actually a lot of psychology to what I do. So really wanting to educate the patient to say, this is what can be done realistically, but what else is going on in your life? Do we need to put you in contact with your primary doctor, with a psychiatrist or anything if you're going through a hard time, to make sure that you're in the right mindset prior to going to surgery as well?
You're one of the few that talk about the psychological part of a plastic surgery. Mm-hmm. Have you had any of those patients that they come with a picture in hand? Mm-hmm. I want to look like this, and you can tell this person already got multiple plastic surgeries. Mm-hmm. And probably they went like 3 or 4 lipos rounds. but the customer wants one round and look exactly the same. Did it happen to you before?
Yeah, and that's where that education discussion comes into play. So I tell people, hey, the picture that you're showing me, this patient has had multiple rounds. This result did not happen overnight. They probably got this result over months to years. They probably did other things like wearing body shapers or getting lymphatic massage, so other post-operative care to maximize their results. The other thing is, like I mentioned before, it could be filtered. They could be doing certain things to augment their bodies even more to make it look, different than what it actually looks like in real life. So it's just, again, a discussion of education to say, and everybody's different. So that's the other thing that I have to point out to patients. They'll bring a photo and say, I want to look like this. And I say, well, that patient's body shape isn't the same as yours. Their bony anatomy isn't the same as yours. So you are not going to look like this person. But what I can do is this. And so that's where that education comes into play.
That's so important. Sometimes when I have the same conversations with customers, because one, they already are super angry to their surgeon. Oh, I didn't get the shape I was looking for. Or second, they went to sleep with different expectations, right? So at the end of the day, it's expectations, right?
Right.
So when they wake up, they tell me, like, look, I wanted to look like this. I'm like, yeah, but, your body type is different.
Right.
So they say, people that are not educated in this, because there's a lot of also the misinformation out there, they said, no, we all have the same bone structure. It's the same bones. We have the same amount of bones. How do you approach that when we actually have different body types?
Right. So it actually came up with one of my patients who was talking about having a tummy tuck and wanting an hourglass figure. And so what I do is I position my patients in front of the mirror and I say, all right, look at this, look at your body with me. And so for this particular patient, I said, look at your rib cage. It's this wide. And then I say, look at your hips. It's the same width as your rib cage. You're not going to have an hourglass figure. An hourglass figure is when your hips are wider than your rib cage. Then you can taper in the waist, and then it comes back out to your wider hips, and that gives you that hourglass figure. But if your chest size is the same width as your hips, you're built like a rectangle. We can improve your contour, but you're not going to have that hourglass figure. And so that's, again, I'm showing the patients, like, I'm not telling you I don't want to give you an hourglass figure because I just don't want to give you one. Your anatomy dictates what type of result you're going to get. And so I like to tell my patients up front, here's your anatomy, and this is what can be accomplished based on your anatomy. And for the most part, patients understand that and they appreciate that. They're like, oh, I didn't realize that. So, or somebody who has a really short torso, there's not enough room for me to get that hourglass narrowed waist. So you're going to be more straight. But I think as long as the patients feel like they've been educated and they understand why they can't get a certain result, they're pretty receptive of that.
Now that you talk about the room that you have, right? So there is different sizes of cannulas, right? So basically, do you tailor the surgery according to the body shape, correct?
Yeah, so I treat each of my patients as a unique patient. I don't do a cookie cutter surgery for every patient because every patient is not the same. So I really do look at the patient and say, what does this particular patient need based on their anatomy and what their goals are? And so I will use different surgical techniques or use different instruments to accomplish the outcome that they want that's within reason based on their anatomy.
This brings me to the next question. So there is different technologies that you can use also in the surgical room to achieve those results. Can you educate us a little bit more about that? Because every time they come to me, they tell me, oh, I got a lipodone. What technology did they use? Did your surgeon use? They don't know.
There are a lot of technologies out there. There are different types of liposuction technologies. So you have just regular liposuction, which is just a cannula that's on a vacuum seal and you're sucking out fat. There's ultrasound technology that's been associated with with liposuction now. There's been laser technology that's been associated with liposuction now. All those different technologies are to help promote different things as far as like ease of removal of the fat or additional skin tightening along with the liposuction. There are different technologies that you can do on the surface of the skin as well, like radio frequency devices, again, to give additional skin contraction in addition to the, at the same time that you're removing the fat with liposuction. So the reason that you would use different technologies honestly depends on what the patient needs. The skin tightening is something that would be used for somebody who, one, isn't that they would be a candidate for liposuction, but maybe not quite ready for a tummy tuck, but they have a little bit of skin looseness that you want to try to address. And so adding those energy devices to those patients in particular would help to optimize the results. Not everybody needs a laser lipo or an ultrasound lipo or additional energy devices to their lipo. It all depends on what their skin quality is like.
So basically, somebody that is working out that has already a nice contour, but has a little bit of loose skin, they can come to you for a skin tight surgery.
Right. So it all depends on how much loose skin they have. So that's another thing that I talk to my patients about. There's two things to consider. Is it a fat issue or is it a fat and skin issue? If it's just a fat issue, then you can get away with liposuction only and not need a tummy tuck. If they have a little bit of loose skin, then you can get away with just doing some skin tightening modalities on top of the liposuction to get a good result. But if there's also a loose skin component, then you have to remove the loose skin. If it's more than what could be addressed with a skin tightening modality. And that's going to be a discussion between you and your surgeon and what's realistic and what can be accomplished with these energy devices. And so then that just becomes a discussion of, okay, well, you do have loose skin. It's more than what will be addressed with the energy device. So we need to start talking about a tummy tuck as opposed to just liposuction.
There is a lot of subjects that you need to talk to your surgeon before taking the decision of the surgery itself. So how does people take these decisions over the phone? They never seen the surgeon. They never guess. Like, let me tell you this. A customer comes in, she's very unhappy with the results. But I mean, after the surgery, they come here 24 hours after surgery. So she's still on their medication, but she's already unhappy with the results. So their scars are really bad, really, really bad. And she's just super angry. She tells me, I hate my surgeon. I don't like the results. I didn't expect this ugly scar. So I asked her, how do you choose your surgeon? Oh, I saw the marketing on social media, 50% off, so I just chose my surgeon. That's very sad because you should that's how I chose my surgeon. I built a relationship with my surgeon. I needed to see his before and after pictures. I needed to know who he is, what is his type of job. How do you recommend customers to choose their surgeon or to choose you specifically?
So education is key. I'm going to continue to harp on that. As a patient, you still have to do your due diligence to do your research prior to going under the knife. It is surgery. And I think a lot of people don't realize that plastic surgery is surgery. Complications can happen. So you don't want to make that decision lightly. So what you want to do beforehand is kind of like you said, look up your surgeon. You can use social media as a way to get more information, but, look at their websites, try to find their before and afters, look at patient reviews, and then talking to the surgeon and seeing if you feel comfortable with that individual. Because if you go to a doctor's appointment and you don't feel comfortable with the surgeon, me personally, I don't care what the results look like. If I don't feel like you have my best interest in mind, or if I don't feel at peace with you, I'm not going to go with you. I want to go with somebody that I feel understands my concerns, that cares about me as a person, and that I feel is going to do their best to give me the best results that I can get. So those are different factors that patients should keep in mind when deciding what surgeon they want to go to, not just based on price.
Thank you. Thank you. Very important. Don't, it's the cheapest one. No, don't go there. Well, is what you said is very truth. When I was choosing my surgeon, I got my breast done in 2021. I went to see 5 different surgeons here in the Dallas area. Their marketing is amazing. Their before and afters are amazing. I also have seen their work because of what I do, right? So I get to see everybody's job here.
Right.
Unfiltered version. So I went to see these surgeons. Out of the 5, one of them was the most unprofessional human on earth. So just remember, I see recovery from a different angle. And then I was thinking, okay, if he's looking at me like that right now, what is going to happen when I'm under the anesthesia?
Yeah.
I feel very safe in United States. I'm originally from Colombia, but I feel here we have regulations and a lot of things that protect us as customers, right? But the fact that he was so unprofessional during the first appointment, I was like, no, I don't care about the fee, the consultation fee. This is no for me.
No, and that's important. And you saw red flags, and you decided to listen to those red flags. So I think that's very important for people to understand when they're choosing their surgeon is if you aren't sure, 100% sure that you feel comfortable with that person, get a second opinion, get a third opinion, get 5 opinions until you find the right one.
Yeah.
Because it's important. You want to feel comfortable when you're putting your life in that surgeon's hands. So I think when it comes down to it, do your research, but also make sure you feel comfortable with that individual.
So the day of my surgery, I remember I grabbed the anesthesiologist's hands and I just asked him, can you promise me you're going to wake me up? And he's like, yes, I need you to wake up. But, it's all the anxiety. And I wasn't prepared for that. I never got a surgery, right, before. So I didn't know all the changes. And it's so different when you are the patient.
Oh, yeah.
I read all the books. I've been doing this for 20 years. And, I thought I know everything. The day of surgery, oh, wow. So, like, the anxiety, like, so stressed out. Everything was so heavy on my shoulders.
Oh, yeah.
How do you handle these patients?
So I just try to, make them comfortable, to try to reiterate, hey, this is what we talked about. I'm here to try to give you the best result that you can get. I care about you. I want the best outcome for you. I truly get to know my patients. I know when their kids are graduating college or if they're about to go on a vacation. And so I talk to them about things like that. So, when's your vacation coming up? Have you already set your plans? And getting their mind off of the surgery that they're about to have. And that really helps calm them down. So I think just, treating them like a human being and say, hey, it's okay to be nervous. It's a normal response when you're about to have surgery. It's okay. We're going to do everything we can to take care of you. I know who your family member is that's taking care of you. I will be in contact with them. So don't worry, they're going to be up to speed. I think that brings them some comfort to know that they have somebody that's looking out for them and that they'll be in the loop. And then just bringing them a sense of normalcy by talking about other things outside of the surgery to calm their nerves. So
I also remember telling him, I have 2 sons. I need to be there for their wedding day. So please wake me up. Sometimes we forget that doctors are also human.
Yeah.
And you guys chose this to do good. And sometimes we as customers are so hard on you guys. And for that, I want to apologize for all the customers. For all the customers that got mad at the surgeons without being your fault.
I appreciate that. I think I agree that sometimes I do feel like patients forget that we are humans too. We're not perfect, but we have taken this profession because, like you said, we want to help people. We want to in this particular profession with plastic surgery, give people back their confidence, give them a new start. No surgeon is going out there saying, I want to put out crappy results. Every surgeon wants to go out there and put out the best results that they can, but this is surgery and complications can happen. And so that's why it's important for the patients to understand, yes, 99% of the time things go fine, but there's still that 1% where something could go wrong. It is still surgery. So make sure that you're not making this decision lightly, and that you're doing your research, you're doing your due diligence, and that you feel comfortable with the surgeon that you've chosen.
What tips do you have for customers that are about to take this decision? Is there a way that you prefer them to prepare their body for the surgery itself?
So, surgery doesn't start and end on the day of surgery. And I'd like to educate my patients when they come in about what can you do to optimize your results. And that starts even before you have your surgery. So some of the things that a patient could do is make sure that you're healthy, that you're eating healthy, that you're exercising. The healthier you are prior to surgery, the easier your recovery is going to be, the better your results are going to be. If you are eating crappy food, you're running out of breath after going up 2 flights of stairs, if you're smoking, you're going to have complications, whether or not that's, just minor wound healing, particularly if you're a smoker, because smoking already is going to put you at a higher complication level than somebody who's a non-smoker. But doing things to make yourself healthier prior to surgery is going to help you recover faster after surgery. So usually what I tell patients is before you have any surgery, you want to try to get to your ideal weight, at least a few months prior to surgery to show that you're stable and maintaining that healthy weight prior to surgery. Because one thing I don't want my patients to do is if I tell them, hey, we do have what we call BMI cutoffs, which is body mass index. The reason we have BMI cutoffs is because the higher the BMI, your complication rate shoots up. And so surgeons will have different cutoffs. Usually it's between 30 and 35. So if a patient comes in above that threshold, as I will tell them, we want to do safe surgery. This is elective surgery. If we want to do this safely and optimize results, it's beneficial for you to lose the weight first and maintain it. But what I don't want my patients to do is go and crash diet to lose the weight, have the surgery, and then they can't maintain that crash diet. They binge eat, and then they gain all that weight back, because that will make your final result not ideal. The body will put on the fat in other areas that maybe you hadn't before. And so it just turns into a fiasco. So what I ideally would like my patients to know is get your ideal weight and maintain it with a healthy diet and exercise regimen at least 3 to 6 months prior to surgery, so that after surgery you can maintain that routine and maintain your results. Other things that people might not think about prior to surgery is the timing when you're thinking about having surgery. So don't plan to have surgery, a few weeks before you're going on a cruise. Don't plan to have surgery a couple weeks before a wedding that you're trying to get ready for. You want to give yourself time to recover from the surgery prior to any big event or any travel. The last thing you want to do is have surgery and then go out of the country and have a complication that now you can't deal with your surgeon because you're out of the country. So planning around important events is key. The other thing is making sure you have support for after surgery. So I've had some patients that have no family support. They rely on maybe 1 or 2 friends here or there. And I have to tell them, after surgery, you're going to need help. So you need to plan your surgery around when your family members or your friends are available to help you, because your recovery and your results are dependent on you being able to follow your post-operative instructions, restrictions on activity that you can and can't do, and maintaining your health afterwards, making sure that you can get up to the bathroom, making sure that you can cook and feed yourself, making sure that you can keep your wounds clean. If you're going to need help with those things after surgery, you want to make sure that you have the appropriate help after surgery. And so that planning starts before you sign up for surgery. So these are things that I talk to my patients about beforehand to prepare them for what to expect after surgery.
A doctor is saying exactly what I say in my videos, but nobody listened to me. Probably you guys listen to her. So when there is a wrong idea that's growing and growing now with social media. The lipo is a weight loss surgery.
No.
So they come back after surgery and they tell me I didn't lose any weight. Why do you think it's only 5 pounds? This is 5 pounds. So it's a contour surgery.
Yep.
Also, can you tell us a little bit more about complications being overweight? Like being overweight, how can this make more complicated your healing process?
Right. So to address what you mentioned before about liposuction being weight loss surgery, it's funny that you mentioned that because I actually tell my patients that all the time, particularly ones that when I'm hearing these terms like, oh, like I can't lose any more weight, but I really want to get down to this, and so I want liposuction. I stop it right there and I say liposuction is not a weight loss surgery. If you want weight loss, then that's diet and exercise, or if you meet the criteria, bariatric surgery, like a gastric bypass or gastric sleeve or a lap band to then lose weight. But liposuction itself is not a weight loss surgery, and I tell my patients that up front. And I tell them, do not expect to get on that scale and weigh less. And actually, immediately after surgery, you will weigh more because of the fluids that you received during surgery and the fluid shifts that have to happen after surgery. You're actually going to weigh more right after surgery than when you went in. So I tell my patients straight up, you are not going to lose a lot of weight with liposuction. It's to contour the body. If you want weight loss, diet and exercise, or bariatric surgery if you meet the qualifications for that. So, what were you going to say?
Yes. So when I have patients, they come trying to buy fajas or garments from me. They tell me, maybe right now I'm a medium. Probably I'm going to need a small because I'm going through surgery. I said, no. If you're a medium right now, you're going to need a large because you're going to be swelling. And then maybe if you do your lymphatic drainage and your post-op or my post-op protocol, probably in a week from now, you are going to go down one size. But if you are the kind of patients that don't do any post-op treatments, for you to go down one size is going to take you at least a month. So they don't get it at first. But you go up before you go down.
Yeah, I think patients, we're in a society where everything is instant gratification with Instagram. Oh, this person went and had liposuction and bam, she's bikini ready on the beach looking great. She did not get there overnight. She went through a recovery process where she was swollen, she was bruised. She hopefully did some type of postoperative care to minimize that, wearing garments to help shape the body. But that takes months to get to the point where she's bikini ready. But of course, on social media, it seems like it's overnight. And so I think patients get these unrealistic expectations like, oh, I'm going to go in and have the surgery, and the next day I'm going to be walking the red carpet, and it doesn't work that way.
Exactly. So can you, fat is a little bit dense. How do you guys get it to be liquid to take it out?
So when we do liposuction, we infuse the surgical area with a solution called tumescent. And in that solution, it usually includes lidocaine, which is for pain control, epinephrine, which helps to control bleeding and postoperative bruising. You can add a few other medications to it, but that's the typical 2 medications that you see in tumescent is lidocaine and epinephrine. And that's mixed in a solution of normal saline or lactated ringers, which is just fancy terms for the bag of water that you get through the IV. We use that same fluid. We just add in the lidocaine and the epinephrine and infuse that to the area where we're going to do liposuction. So what that does is it helps with pain control. It helps to control bruising and bleeding, but it also helps to separate the fat cells with that initial infusion of the fluid. And then when we do our liposuction, that then mechanically removes those now loosened fat cells.
A lot of patients ask if the end of the cannula is sharp or if it is round.
So there are different types of cannulas. For the most part, they're rounded at the end, but there's a difference in the amount and location of the holes at the end. And it all just depends on one, how aggressive you want to be with your liposuction. If you're planning on injecting that fat back into another area, would be reasons that you pick one cannula as opposed to another. But typically the end of it is not like a needle point. It's a rounded tip, but there's holes at the end, which is where the fat goes through.
That was one of the questions that my customers asked, because they had the idea it was sharp, so maybe you can cut and like stab any organ.
I mean, that's always a risk. That can happen, and it has happened, in medicine, I should say. But the safety of it comes with your surgeon having the appropriate training and knowing what plane they're in when they're doing the liposuction. So that is, it's a complication that can happen. It is an extremely rare complication, but it is a serious one if it does occur. So that's why making sure that you understand the training of your surgeon is very important, because you want to make sure your surgeon knows how to do it safely. And that actually kind of brings me to another point where there are people out there that are doing cosmetic surgery procedures that aren't plastic surgeons. And that's where that patient education and due diligence comes into play, because you really want to make sure that you are having a procedure done by a plastic surgery trained individual. Because there are non-plastic surgeons performing liposuction because they took, some course, or they shadowed a couple of surgeons, here and there, and now legally they can perform it because they're physicians, which, do they have the same training as a plastic surgeon? No. And so you want to make sure you're going to somebody that has the appropriate training.
How long is the plastic surgeon training?
So you have your 4 years of undergrad, college, and then you have 4 years of medical school. And then after that, you go into your residency training, which is another 6 to 7 years, depending on the program.
Wow.
And some people can go on to do an additional year of training called a fellowship after that. So
I lost count.
I can't do math. That much math in my head. But it's a lot of years of training. And in your residency is when you do your core plastic surgery training, where you get that exposure. And so you'll have people, like I said, that are out doing liposuction, and maybe their initial training was in, emergency medicine. They weren't operating. And so when they then go and take a course to learn how to do liposuction, do they have the same years of training as a plastic surgeon that's been doing this for 6-7 years in residency before they come out? No, they're not going to be at the same level. We have a different understanding of the anatomy than somebody that's just taken a course or shadowed a few surgeons here and there. So I think it's important, like I said, to make sure that you're educated on the education of your surgeon. Are they a plastic surgeon? Are they a facial plastic surgeon? Or there's different types of plastic surgery. And so a plastic surgeon in general can do face, breast, and body. There's facial plastic surgeons who only concentrate on the face and neck. There's oculoplastic surgeons who concentrate on the eyes.
Really?
So there's all these subspecialties within plastic surgery, but you want to see that plastic surgery to really know that they have that years of training behind and underneath their belt to know that they truly do know the anatomy on the with the surgeries that they're performing for patients.
Well, I love to watch plastic surgeries. I don't know how many, I'm not a surgeon, right? Mm-hmm. But in order for me to get where I am right now, I had to be in many surgery rooms. Mm-hmm. And I practice post-op care with many plastic surgeons. So to me, it's amazing. I love to see. And I think I'm not tired of saying this. I think I will never get tired. But to me, it's amazing that in the morning, during the day, you cut people open, you fix many things, and now you're sitting here with me having a normal conversation. It's super cool.
Yeah, I mean, we are regular people.
Right? With an amazing job.
Yeah, I mean, we just have a job that, is very unique. It's a job that we love doing. We love helping people. We like working with our hands. We like that instant gratification. We know as a surgeon, oh, this is going to look really good when she's healed. The patient might not see it, and that's when it comes to a patient-doctor relationship to say, hey, let me hold your hand as you're going through your recovery because I can see where you're going to be. You can't see it yet. But having that experience to be able to tell patients and let them know, like, hey, you look great. Don't worry about the swelling. Like, that's going to go down. You're going to have a great result. But, you know, we're in a unique field where we get to do cool things that the everyday person doesn't get to see.
Right.
But at the end of the day, you know, we put on our pants the same way as anybody else. You know, we have our families at home that we want to get home to. We have our extracurriculars and things that we like to do outside of operating. So, you know, at the
What
end
do
of
you
the day,
like
we're
to
still
do?
like I mentioned, I have 2 little ones. So I spend a lot of time with my children and doing things with them, getting them to sports and activities. I was an athlete growing up, so I like being very active. I played volleyball and basketball.
Wow.
Those are my sports. And I played that through college. And my husband is also an athlete, so it just, you know, is in our blood to be athletes and be very active. So that's what I like to do. I like to be outside. I love the sunlight. I love, you know, cooking. My husband and I, we like to watch different cooking shows and experiment in the kitchen. So just,
That's
you know,
nice.
regular things like that.
That's really nice. But here is where your expertise and mine connect together. I love to make them feel better and look better as soon as possible.
Yeah. I mean, I looked at some of your results on your website. I mean, these are amazing results that you've gotten for these patients. You know, I think that it's important for patients to understand the full process. You know, like I mentioned before, the surgery and your results don't end the day of your surgery. The postoperative care is very important. And so I think the services that you guys offer here helps patients to not only, you know, maximize their results, but it also helps to get them there faster and get them there more comfortably. So I think you guys are doing amazing work here, and your before and afters, like I said, have been pretty impressive. So
Thank you.
you know, you guys are doing an awesome job here.
So to me, it's very, very important for them to start enjoying their surgery. So what happened most of the times is that they get out of surgery, they didn't plan anything after surgery. They go home, they're in pain, they're swelling, they don't have nobody to help them, nobody to drive them around because, like you said before, they feel this is not a surgery. It is still surgery. Your body went through trauma and
Right.
it needs to heal. So there is a big psychological part of
Right.
recovery itself. So they go home, they don't have nobody to help them. All this negativity, all of this heaviness, the trauma is so much for your body, your mental health, your body itself, like it goes through a lot. So this is more holistic, but your emotions affect your lymphatic system. So your lymphatic system is already not working. And on top of that, we have all the medication
Right.
the surgeon put in your body. So many things are happening all at once. So the recovery sometimes is very slow. So when they come to me, they come 24 hours after surgery. And they don't have to contact their surgeon anymore. We just report. Today we got your customer. This is how we work here. We have this protocol. It's very well established. So Dr. Cooper, we got such and such. She started her post-op treatment today. So you know she's in good hands already.
Right.
We take before and after pictures. If we see everything is going well, at the 5th session, we report one more time. And just like that, every 5 sessions, we give you reports. If there is something that is not supposed to happen and it's happening, we just call you right away so you know what is happening. Patients don't know how to take care of their incisions. For more than you explain to them, they don't. They don't. So sometimes they don't change their garments for days. Like days goes by and they don't change it. So what happened most of the times is, no, my surgeon told me I don't need more garments. Yes, you do. You need more than one set of panties, right? So it's the same with the garments. This happens very often. The incisions keep leaking, right?
Yeah.
And then the garment is collecting all this bacteria. And the same garment is causing an infection. Can you tell my customers, or your patients that are watching right now or listening to this, how important it is to keep the incisions clean, dry, and change the garment?
So we have post-operative instructions for a reason. It is to keep you safe during the recovery, is to help maximize your results after recovery, is to decrease your risk of having a complication after surgery. Part of those instructions is incision care. So we talk about keeping it clean, keeping it dry. So all the things that you've mentioned, decreasing tension on your incision. So for example, with tummy tuck patients, I tell them, you're going to walk hunched over for a little bit because I'm pulling you nice and tight. If you try to stand up straight, you're going to be pulling tension on that incision that I just made. That can either cause the incision to open up, or it can cause your scar to widen or thicken, because scars will widen if it's under tension. And so, again, it just comes to educating the patients as much as you can. At the end of the day, the patient's going to go home and do whatever they want.
Exactly.
But the one things I will say with my patients is you can't say that I didn't tell you. So I lay it out to them and say, this is what's going to help give you the best results that you can get to decrease your risk of complications. And these are the instructions for a reason, because we want to give you a safe and event-free recovery. Now, you can do everything with the post-operative instructions correctly and still have a complication. So it doesn't mean if you do everything to a T that everything should go perfect. For the most part, it will, but people's body heals differently. Things can happen. Maybe you went to lift something one day and you felt a pop and your incision opened up. Things happen out of our control. But the reason for the instructions is to decrease the risk of something bad happening as much as we can. So keeping the incision clean, like you said, is one of them. Keeping your garments clean. I tell my patients, hey, wash your garment, have a second one so that you can have one that you're wearing while the other one is washing, and you can trade them out. You want to keep all those things. It's important to listen to the instructions from your surgeon, and if you're going and having post-op recovery with companies like your own, you guys have protocols for a reason, because your protocols have shown that they worked. So yes, abiding by those things is important if you want to optimize your results with the least risk of having a complication.
Let me show you how I divide my protocol. So we have 3 different stages. So right after surgery, those are the things that we focus on, just right after surgery. Usually by the second week, we already go to the second stage.
Okay.
But everybody heals different, like you mentioned. So there's people that stay in the first one a little bit longer, maybe 2 weeks, maybe 10 days. But we avoid the curve to go up, the swelling, the inflammation phase to go up. We try to keep it like as low as possible and just bring it completely down so they can enjoy their surgery in their life.
Yeah. No, this is good. And I think the fact that you will also tailor it. So, you're not hard, fast, like, oh, week 2, you have to go to stage 2. You're tailoring it to how's the patient's body responding right now? Do I need to keep them in stage 1? Then yes, I'll keep them in stage 1 as long as I need to, and then advance them to stage 2. So I think, again, it becomes that individualizing your protocols, just like I individualize my surgeries to the specific patient. And that's how you get good results, is you don't treat everybody like a cookie cutter.
Exactly.
Everybody's different. And we kind of touched on this before, like yes, everybody's different, but even within ethnicities, we heal differently. So people of color, we have more collagen in our skin. We form thicker scars naturally than somebody with less pigment. And so educating our patients on what to do to optimize your scar, particularly when you're a person of color, is important. I think, one of the questions that I ask my patients with darker pigments is, do you have a history of keloiding? Because that's something that's unique to people of color and Asian populations as well. So when I have those patients that come in to me, I ask them specific questions that I know might be more relevant to them because of their background. And so then I educate them and say, okay, well, if you have a history of keloiding, this is what we need to do to make sure that that doesn't happen or to decrease the rate at which you keloid. And so I have those, again, tailored discussions with my patients based on their uniqueness to make sure that we can come up with a plan that's going to optimize their results specifically for them.
That's a very, very important subject, and I'm very thankful that you mentioned it, because yes, Hispanics, Black people, we all have different healing, and sometimes we don't give enough focus on this, right? So they get prepared and ready for the surgery day. But what is after? How are you going to heal? How are you going to take care of the incisions? Right. The surgery is just one day, but you're going to live with the scars forever. How are you going to treat your scars?
Right. And like I mentioned, I have those discussions with my patients. I'll have my patients, I'll ask them, do you have other scars? Show me your other scars. I want to see how you scar. And so I'll have patients of color that show me hyperpigmented scars, very dark colored scars. And then I educate them, like, look, if you have this history, your body's showing me that you tend to have darker scars, there's a chance that you could have the same thing if you're having a tummy tuck. So now they're at least, that's on their radar. It's not going to be a surprise to them if it happens. What can we do to decrease the risk of that happening? Well, there's different creams. Maybe there's different radio frequency devices that we can use. Some lasers are safe with people of color. So there's things that we can do to try to optimize your scar if that were to happen, if we see that that's happening. Because that's also my mind frame, I'm looking for that when I'm seeing them in their postoperative visit. Oh, it looks like you might be starting to keloid here. They might not even notice that. But because I have the medical background, I can see, oh, it looks like you're about to keloid. We need to start doing things to prevent that from progressing. And so I think I do have a unique position as a woman of color to know the skin issues that women of color, well, not just women, but people of color have, and to be able to identify those things early on and knowing what modalities and treatments are available to help treat those things so that we can optimize their scars after surgery.
I had this conversation a couple of weeks ago. We sent out pictures. We don't have a relationship with this surgeon specifically, but it doesn't matter if we work with the surgeon or not. As far as I get the patient, I report to the surgeon. So we send out the pictures, and we emphasize on this part of the incision, because to me, he needed to take care of the incision. So we do regular before and after pictures, and then we just show whatever is abnormal or not normal. And he emailed us back, how do you know that it's actually about to be something else? By looking at it, by touching it. Like, I can see more with my fingers than with my eyes. And because of this email, he actually invited me to come to meet, right? So he's like, he didn't understand. He's white American. He didn't get it. Like, why just by touching it, I know something is happening.
Well, that's good that he was at least receptive to being educated on the knowledge that you have. I think that's one thing that as physicians, we have to humble ourselves at times and say that we don't know it all. And there are other providers out there that they see it differently than we do. Yeah, we look at a scar and we know the typical postoperative recovery and things, but you look at postoperative patients all the time, all day, you see their scars, you see different skin types, you see how they respond. So even though we're both in the medical profession, we're both dealing with surgical patients, you have a different perspective on the recovery process because that's all you're seeing is recovery, recovery, recovery. I'm seeing patients in clinic. I'm in surgery. I see a post-op patient here and there, but this is in your face 24/7. So you have a different perspective on it than I do as a surgeon. So I think it's important for surgeons to say, hey, there are other people that have different perspectives that might see something differently that can then educate me on their perspective that can help me be a better surgeon and have me look at things differently and say, oh, wait, I'm noticing that same thing now that I didn't notice before because I've been educated by a colleague. So I think we have to humble ourselves and say that we don't know everything, even as surgeons. We are human, and we can learn from other providers out there.
Doctor, we have so many things that we can talk about, and I don't think 1 hour is enough. I really appreciate you coming here to educate us. I would love to have you here any other day.
Yeah, no, I appreciate it. Thank you for having me. Like I said, I like having these conversations. I like learning from colleagues. So I think just continuing the discussion, educating our patients on what we do and how we can work together to optimize the results is awesome. So thank you for doing these podcasts. I think that's really awesome.
Thank you for your time. And yes, I love to educate customers or patients because I will like them to go to professionals like you. It hurts me when they go to another country and they choose, we call them butchers, or people without any licensing and stuff like that. So I'm very happy that I have a strong woman here that would like to share her knowledge with us. I really appreciate that, Doctor.
Yeah. Well, thank you for having me.
You're welcome.
And if anybody's interested, you guys can follow me on social media at Danielle Cooper MD. I'm on Instagram and TikTok. So
yay!
Yeah.
We're gonna add all her social media and all the videos. If you are listening to this in Apple Podcast or Spotify, we also have her social media link down below. Please go give her a follow.